Okay, welcome everybody to Health Services Management and Policy 5400. This is Data-Informed Decision Making in Health Services Administration. My name is Mike Smith, and the purpose of this video is to really lay out the expectations and give an overview of the course. So that's what we'll do. This should not be too long or too onerous. So my hope is that you'll be able to refer back to this video during the semester if it would be useful. So just quickly, a little bit about me. Again, my name is Mike Smith. I grew up in the state of South Carolina. I grew up in Greenville, South Carolina, the northwest part of the state, a town called Simpsonville. And I went to college at Presbyterian College, which is also in South Carolina, in a small town called Clinton. And I studied math and computer science there in college from my undergrad. And then I went to grad school at the University of South Carolina in Columbia. Go Gamecocks. So I studied biostatistics, a master's program in biostatistics in the School of Public Health at the University of South Carolina, and also did a doctorate, a DrPH in biostatistics, also there at South Carolina. While I was still a master's student, before I was in the second year of my master's program, I started a full-time job at the South Carolina Department of Health and Environmental Control. I worked initially in the PRAMS program, the Pregnancy Risk Assessment Monitoring System. It's a survey program that surveys women who've recently had babies about their experiences before, during, and shortly after pregnancy. It's a really cool program to be involved in and to kind of learn about real-world public health and real-world public health data collection and population surveillance and things like that. It was a great experience. I worked there with PRAMS for a couple of years, and then moved into some other roles within maternal and child health at the Department of Health and Environmental Control in South Carolina. I was always, throughout my time there, focused on maternal and child health epidemiology, data analysis, program evaluation, data collection, and things like that. I worked for most of my time there as the director of the Division of Research and Planning for maternal and child health, where I oversaw some large grant programs that we might talk about some throughout the course of the semester. And I also worked with a variety of data collection programs that collected data from medical records, right? We had nurses that went around the state collecting data out of medical records. We also had programs that we were managing data that were collected by, for example, the WIC program, right? The Special Nutritional Supplemental Program for Women, Infants, and Children that's available in every state and territory in the United States. Also, the Title X Family Planning Program generated a lot of data, and we had that data. We also collected data around maternal morbidity and mortality from a variety of data sources, data related to congenital anomalies and birth defects from across the state. And of course, we also utilized a lot of vital records data, birth certificates, death certificates, reports of fetal deaths, induced terminations of pregnancy, so abortions, and also worked with survey data like PRAMS data, Behavioral Risk Factor Surveillance System data, BRFSS, Youth Risk Behavior Survey data. So we really had a lot of data that we were working on, but we were primarily focusing on understanding things like infant mortality and a lot of the tragic and poor birth outcomes that happen in a state, and working on analyzing those data toward trying to find ways to reduce the prevalence and incidence of those issues. We also did a lot around maternal health and family health, and we also did a lot related to children and youth with special healthcare needs, and then on into adolescent health. So I worked at the health department in South Carolina, again in a variety of roles, becoming increasingly administrative. So I was using data kind of less and less, and having more administrative duties over the course of my career there. But I worked there for over 10 years. I really enjoyed my time there. I'm happy to talk about it and answer any questions that you might, or well, if you don't have questions, then I won't answer them. But any questions that you do have, just feel free to shoot me an email, give me a call, whatever. I came to ETSU a little bit over 2 years ago. I was brought in as research faculty. I've since transitioned to tenure track faculty here at ETSU in Health Services Management and Policy. My primary role here is to be the evaluation director for the Choose Well evaluation that we're working on. And it really leverages a lot of the programs, the data sources, the people that I worked with in my 10-year career in public health in South Carolina, because the Choose Well is an intervention that's really all about access to women's health and reproductive health issues. So access to things like birth control for women across the state of South Carolina. So there's a big program, a big statewide intervention going on in South Carolina that's really trying to promote and really help women be able to access the full range of birth control options that they should have access to. And that's going on from 2017 through 2022 in the state of South Carolina. And our role here at ETSU is we are the external evaluators of that program. So it's a great fit for me because I get to work on the data and research things in a context and with partners that I'm really familiar with in the state of South Carolina. But instead of working on the programmatic side there, I'm really working on the evaluation and the research side here at ETSU. And we have several evaluation projects that make up this larger evaluation initiative here at ETSU that I'll talk about as examples throughout the semester. So I'm thrilled to be here. I'm really excited to be able to teach courses here also, and it's been exciting to transition from a practice career into a career that's still very practice-based, but in an academic setting, because I have opportunities to contribute in different ways and to work with students a lot more and teach courses and things that I'm just really excited about. Okay. Some other things about me, non-career related. I have two daughters. Catherine is our older daughter. Claire is our younger daughter. This is when Claire was born, when we were in the hospital. Catherine is now 5 years old. Claire is now 2 years old. This is Claire. We have a little farm in the area. This is Claire snuggling with our miniature donkey, Tumbleweed. He's one of my favorites, Tumbleweed is. We also have 3 big horses. We have 4 ponies of different sizes. We have 2 small ponies, one kind of medium-sized pony and one big pony. We have 3 pigs. This is one of our pigs, Clover, when she was a baby. Clover, they're all small-ish pigs. They're potbelly pigs. Clover is actually a Juliana pig. And Clover lives in our house a lot of the time. So there she is when she was a baby, meeting our big fluffy white cat, Chevy. We also have some ducks, some chickens, some sheep, and a couple of dogs. So we have a little farm. It's a lot of fun. And we absolutely love living here in the Tri-Cities area and being here at ETSU. So I'm glad to be here. I really look forward to getting to work with you in this course. And I'm also excited to learn more about you now that you know more about me. So what I ask you to do is just submit a few sentences. I've set up a Dropbox in D2L for you to just submit some brief introductions of yourself. Just give me a few short sentences Doesn't have to be much. Don't spend a lot of time on this, but it helps me to know a little bit about all of you. So if you could tell me your name and where you're from, some things you like to do for fun, the level of math and statistics in your background. That's good for me to know, so I know kind of at what level to talk about things. I want to assure you that this is not a statistics course. So we're not going to be using a lot of formula, and we're not going to be coding in SAS and things like that. But it is helpful for me to know kind of your statistical and mathematical literacy. So, and it's fine if it's not very high, just tell me. Also, please let me know what you would like to do and what you plan to do when you graduate, or if you're currently working full-time, what your employment situation is, or if you're working part-time, the types of things that you're doing, but also career trajectory-wise, what type of things you want to be doing, and then some things that you'd like to get out of the course, and anything else you think I should know going into this course. So again, that looks like a long list to me now that I'm looking at it, but I don't think that it would take you very long to just type this up quickly and submit it on D2L. So please take a couple of minutes to do that. Again, it would just be really very helpful for me as I move through the course.